Now, when is bed rest appropriate, if ever, for back pain? We hear it all the time. I still hear it to this day. Doctors saying just rest, don't do anything for your back. When is it appropriate for bed rest?
Yeah, well, that's an excellent question because, like most of my answers, there's a time and a place. And what I mean by that is those people who are listening to this who've experienced the real sharp stabbing back pain and they're about 30 years old, that's discogenic back pain. When the person gets locked up and it's just absolute murder with these, they will describe the sensation like knives going into their backs, probably laying down in bed rest for half a day is advisable. However, the trick is to, as you are laying, trying to find a position that resolves this very acute sharp attack. So if it is of the type, say the person was bending over and tying their shoe, or they sneezed and that threw their back out, that is a flexion-based disc bulge, and it's trapping a nerve root, creating that real knife pain. When they're laying in bed, if they could lay on their tummy and work into a position where they could put one fist under their chin while they're laying on their tummy, they would find that they could then stand up, work themselves up onto their hands and knees, sidestep out of the bed, get to an upright position, and they'd find that that would enable them to really shorten the duration of bed rest so they could get moving once again. And the funny thing is, disc bulges that create those very sharp acute attacks can be worked back into the center of the disc, reducing the bulge, if the right combination of positions and loads are generated in the back.
Okay. And
Ian, may I just say one more thing to answer your question? I
Sure.
think the other part, when docs say, "Oh, just try bed rest for back pain," that has been shown to not work well at all. That's we're not talking about the stabbing sharp attacks now. That's just someone who is just getting worn out from their back pain, so their solution is to simply go to bed, and that's just a spiral.
Perfect. Thanks for clarifying that.